You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. No more dentures. With us, we have an expert on the topic, Dr. Todd Shatkin. Dr. Shatkin, welcome back to the program, I should say.
Thank you, Randy. It's great to be back.
Now, for people that don't know you, I guess you teach dentists all over the world.
Yeah, I do. I've been lecturing and teaching dentists how to do these mini implant procedures for about 15 years. It's fantastic.
How many have you trained? Do you know?
Over 20,000. Over
that
20,000 dentists around the world.
Now, we've had other guys, you know, people need to know it's a real interview. I'm not trying to endorse you on the show, but I've met people that have trained under you, and everybody has nice things to say about you, so thanks for coming on the show. Because you're one of the pioneers, I guess, of this mini implant dentistry.
Thanks for having me, Randy, and it's nice of you to say that. You know, we've come a long way in the last 15 years with mini dental implants. It's really remarkable what we can do for patients.
So really, you believe no more dentures? Like when we say at the top of the show, nobody should be wearing a loose-fitting denture?
Nobody should suffer from loose dentures. Loose dentures should be a thing of the past. You know, so many thousands of Americans, tens of thousands of people out there suffer from loose dentures.
So where you are, there's a lot of people, like just in Buffalo, tens of thousands of people?
Absolutely, tens of thousands of people just in Western New York alone. I mean, around the world and around the United States, there's millions of Americans who suffer from loose dentures every day.
Okay, good. Now, for people that don't know your practice, who's the typical patient? And I guess you focus on replacing missing teeth with implants.
Absolutely, and it doesn't necessarily have to be a full set of teeth that has a full denture. It could be somebody who wears a partial denture, could be somebody who's just missing one or more teeth that wants to get those spaces filled in with teeth. And we can do that in 1 or 2 short visits with almost no discomfort at all and no surgery.
So there are tens of thousands of people, like in and around Buffalo, that have an upper or lower denture.
Yeah.
If it's so good to get mini implants, why aren't they all doing it? Why aren't they all coming in and getting their teeth locked in?
Well, the main thing is we have to get the word out, and thank you, Randy, for helping me get the word out, because this is very important to let patients know what's available. If they don't know that it's available, then they're not going to come in. So many dentists have told them that they can't have implants. They've been told.
So they're told at other places they can't do it.
Right, they're told time.
Well, then what are you
and
doing
time
that's different than what the traditional dentist may be doing?
It's a big difference, Randy, because with the traditional implants, the conventional old-style implants, you have to have 7 or 8 millimeters of bone to do those. And many, many patients don't have 7 or 8 millimeters of bone. But with the mini dental implants, we only need 3 or 4 millimeters of bone, about half as much bone. So the patients who've been told by these dentists all over the country, all over the world, that they can't have conventional implants unless they have a bone graft or a sinus lift surgery or ridge splitting procedures, all these invasive surgeries, we can do these mini implants without all of that surgery. See, the patients get scared away when the doctors tell them they need sinus surgery and bone grafts and bone taken from their hip or cadaver bone or synthetic bone, whatever it is. Patients don't like to hear that. That's very nerve-wracking for them, makes them nervous. But when they come to me and they can find out they can have the mini implants done in 1 or 2 short visits without any surgery, they're blown away and they love it. And they have the procedure, then they tell all their friends about it.
Now we should mention, everything we're talking about today, you teach other dentists across the country.
Yeah.
In fact, you've developed, I guess, a system, a protocol, if you will. Tell me a little bit about that.
Well, it's called the FIRST technique. It's fabricated implant restoration and surgical technique. And Randy, in 2003, I applied for a patent on this procedure because it was a very unique procedure. And in 2006, I got that patent issued, and that's what I've been teaching dentists for the last 12 years.
So dentists from all over the country fly to you?
They come to Buffalo. We have a training center in our building. We're actually building a 15,000 square foot addition on our building to put another training center in. And we have these doctors, we had 80 doctors out last week where we taught them the new techniques with the mini implants. You know, it's a constantly evolving process because what we did 5 or 10 years ago, we've improved upon that, and we're offering new procedures, new products, new materials which last longer, are better, more durable, and more beautiful for the patient.
Okay, now we have a video clip of a woman. I saw a little bit of it. She looks at her teeth, she's smiling, she seems to get choked up.
Yes.
Tell me about this patient, what she had done.
Yeah, that's a great story, Randy. This is a young lady who is a waitress at a local restaurant in Amherst, New York. And I've been to that restaurant and I've seen her, and she was missing half of her smile on the upper. Half of her upper teeth were gone. And, it's not my place to, I don't try to solicit patients out in public. That's just not my way. But I was, concerned, and I thought, boy, it would be great to give that girl her smile back. And it was coincidental. Just a week or so later, I got a call from another fellow patient of mine who said there's this individual who's a waitress at this restaurant.
Wow.
And she said, Todd, you really need to help her. And this was a patient of mine, but also a friend. And she said, you really need to help that woman. She's a beautiful girl, but her smile takes away so much from her. And I said to my friend, I'd be very happy to help her, but she's got to come in for a consultation. And I didn't feel comfortable telling her, you need to get your teeth fixed. So she said, leave it to me. I'm going to talk to her.
Okay.
And I said, you get her in. I'll give her a free consultation, and we'll talk about what we can do for her. So sure enough, she made an appointment. She came in, and we discussed what we could do for her, and we performed miracles for her.
So she would have had a denture.
She would have had
just a regular denture.
She would have had a denture. In fact, she had a partial, and she couldn't wear it. She couldn't wear it. It bothered her. So she didn't wear it. So she walked around with half of her teeth missing.
Did they look real? I mean, what you did for her, so you gave her permanent teeth, they look good.
She was blown away by it.
Okay, let's take a look at the clip.
Her teeth are beautiful.
Let's take a look at the clip.
Oh my God.
They're so beautiful. Do you love them?
I love them. I'm gonna cry.
Yay! Gorgeous.
Smile. Let's see. Yeah, they're very pretty.
Pretty. I'm like a whole different person.
Very nice. Is that common?
It's very common, actually, and that's just one of dozens of stories that I could tell about patients who've been suffering for years. And many times, it's not necessarily because they don't have the money to have the procedure done. A lot of them are scared to go to the dentist, unfortunately. And with modern techniques in dentistry, they don't need to be scared. These procedures are simple. They're minimally invasive. They're very little time in the office. They're less expensive. They don't have to have a lot of long healing times. All of that's gone by the wayside with the mini implants.
How old could you be to get this done? I mean, could you be like 80?
We do patients from 14 years of age all the way up to 100 years of age.
Why would a 100-year-old want to do this? What's your oldest patient?
I had a patient, believe it or not, who was 100. She was 99 years old when I replaced a tooth for her. She only had one missing tooth at 99 years old.
Okay.
I replaced her tooth. She turned 100. She came to me on her birthday. It's a great story. I gave her roses on her birthday because she came to my office. I knew she was turning 100 years old. If you're healthy, if you're walking and talking and breathing and functioning, it doesn't matter what age you are.
So even they're not more likely to fall out if you're older?
No, not at all.
Really?
If somebody's healthy and they can function, they should have teeth until they die.
Would you say this is
Who's
like the
to
third
say-
set of teeth?
Yeah, who's to say at 90 years old you're too old to have teeth? That's not right. Plus, they're going to live longer if they have teeth. They got to eat. And malnutrition at an older age is the biggest cause of death. And a lot of the reason they have malnutrition is because they have uncomfortable dentures. They can't eat. So they give up and they just drink things through a straw. They drink the Ensure or the milkshakes or whatever. That's not going to keep them alive very long. They need to have nutrition.
Because they can't chew very well.
They need to have nutrition, and if they can't chew, they can't get nutrition. So we do these procedures on people as long as they're, are able to have a procedure done.
Do you hear eating stories all the time? What they could eat afterwards?
All the time.
Like, what do they say?
Oh, I ate corn on the cob. That's a favorite thing. Patients that have had dentures for years, they haven't had corn on the cob since they were 30 years old, 40 years old. And these people in their 80s are, I ate corn on the cob the other day. It was the best feeling in my life. They had an apple. They bit it, took a bite out of an apple, and they hadn't done that since they were a kid.
So in your practice, you have an option. So you could either give them a lock-in, a snap-in, snap-out, upper and lower, or you could give them teeth that don't come in and out.
Right, Randy. I'd just like to show this.
Okay.
So, a lot of patients suffer from loose dentures, but others also suffer from a gag reflex on the roof of their mouth because they can't tolerate the plastic over the roof of the mouth. So with that type of patient, we can make a denture that has no palate, and we put the mini implants in this case 6 of them, and we snap the denture right into the...
Let me take a look at it. So this is like on the roof, and it just...
you can see the
not
denture
exaggerating
that'll
here.
snap off. You can see that there's no pellet on the roof of the mouth. We take that right off.
If you're older, could it be tricky to take out?
Well, we have different solutions for that.
Okay.
We have different types of O-rings. We can adjust the tightness of them so that it's easier for them at first, and then as they get used to it, we make them tight again. So we educate the patient on how to put them in and out, but it's not a problem.
So the snap in, snap out, that's one option.
That's a great option, and that option is good for patients who don't mind taking their teeth out and cleaning them after meals.
Okay.
They have to remove them. But a lot of patients don't want to go to a hospital and have to take their teeth out. Because if you go in for surgery, first thing they ask you is, do you have any removable dental appliances?
That's a good point, okay.
And they have to take them out. And people are embarrassed by that stuff. In addition, people don't like to take their teeth out with their spouses or their significant others. They're embarrassed by it. So we have other options. We can give them permanent teeth. And that's really the most fantastic option available, because we can put a set of teeth in permanently in 1 or 2 visits and completely eliminate the need for removable dentures.
So these mini implants, you say they're 5 times better than regular implants. I'm maybe paraphrasing you a little bit. What do you mean by that?
I say they're 5 times less. They're less invasive, they're less time consuming, there's less discomfort, there's less pain, and there's less visits to the dentist. Now, what are the things that would keep a patient from going to the dentist? What are the things
Pain,
that,
I guess, people
would
are
you
afraid
say
of
pain would be number
Yeah.
1, right? Because people are afraid of
And
discomfort, right?
Cost.
The cost is number 2. And then their time. Time is valuable to people. And if we can eliminate the number of visits, reduce the number of visits, reduce the amount of time for healing, and reduce the cost and the discomfort, patients love it. And that's what mini implants do. They get rid of all of those obstacles. So patients can come in, have their teeth examined in 1 visit. We would take the impressions that same day. The next time they come in, they can get their teeth replaced in 1 or 2 visits.
Wow. It was funny. We were off camera before we started, and you said that there was a guy, saw you interviewed on television.
On the
Comes in-
Alvarez Wellness Hour,
Is that
I
what
might
they
add.
said?
Absolutely. The guy came in, he said, I always ask the patient, I said, what brought you in today? He said, oh, that Alvarez guy.
Okay.
That Alvarez guy. And I said, oh, you saw the interview. And he said, oh yeah, I watched it 3 times. I woke up every day for 3 days. I watched that interview. He said, I know exactly what I want to have done. I want to have my dentures taken out, and I want to have those permanent teeth put in, and I want to have it all done in 1 or 2 visits, and I just need to know how much it is. I've got my checkbook here. I want to get it done. So he wanted to write a check. And I said, well, first things first, let me look at your x-rays, make sure you're a candidate for the procedure. And sure enough, we took a CAT scan. Of course, we have a cone beam CT machine, which is the absolute state of the art in dentistry right now. And we took that x-ray and we looked at it, and sure enough, he had enough bone. Now, he would not have had enough bone for the old style implants.
The regular
big ones.
implants.
He would not
Okay.
have enough bone for that. He would need sinus lift surgery and bone grafting. And he had been told that by many dentists prior to coming in. We looked at his x-ray. We said, we can do this for you. He got his checkbook
He said,
out.
I'm in.
He said, just tell me how much. And I gave him a price. He wrote the check. We scheduled him. And within 3 weeks, he had eliminated his upper and lower dentures and had permanent teeth. We put 12 implants on the top, 12 implants on the bottom, 1 for each tooth, and put permanent teeth in. And that's this procedure right here, where the bridge work goes right in and it stays in. And you can see this is no plastic at all. These are solid.
They kind of look like
these are-
porcelain veneers.
They're
Is that-
solid porcelain teeth.
Okay, so
They're
they
beautiful.
look real. They're nice.
They look like real teeth, and they're permanently cemented in his
Could they
mouth.
chew like a steak?
He can eat anything he wants.
Even chewy foods?
He can eat anything he
Nuts?
wants. Absolutely.
Really?
Yeah. We tell them to avoid popcorn and nuts, but they still eat it.
They do.
Yeah.
So adhesive is gone. No.
No more denture glue. We had a patient story from another dentist. Another dentist that I trained told me this story about one of his patients who had been wearing denture glue, the fixatives over the counter, and had been placing so much fixed glue in their teeth that over time they swallowed that glue. And they ended up going in the hospital because they had a bowel obstruction. And they took an x-ray. They thought he had a huge cancer in his intestine. It turned out to be a tennis ball size glob of denture glue. They removed a section of the intestine and they looked at it under a microscope, and it was pink denture glue. It's not healthy. Patients who wear glue all the time, they swallow it and it gets in and there's insides.
So they don't like it. I mean, that's
It's
one of
not
the...
healthy for them.
Yeah, but isn't it true, here, I'll give you these back, but isn't it true that if you've been wearing dentures for like 20 years, you don't have enough bone to do this?
That's not true, but it's a fallacy, because what happens is, yes, you lose bone over time, but because the mini implants range in diameter of 2 to 3 millimeters as opposed to 4 to 7 millimeters, which is the larger ones, even patients who've been wearing dentures for 15, 20, 30 years, they still usually have enough bone for the mini implants. In fact, 97% of the patients who come in my door have enough bone for mini implants. And only about 10 to 15% have enough bone for conventional implants. So there's about an 80% differential there, where 80% of patients have been told they can't have implants. They can have the mini implants.
And these are about half the cost.
They're about half the cost. It's a much less invasive, and it's less time consuming.
So now what about pain? Because I guess you're just kind of poking through the gums?
Yeah, because we don't do surgery, we almost never have to make an incision. We don't have to suture. The procedure is done through a small pinhole in the gum. The implant is threaded into the bone, and we can load it immediately. Even a single tooth, if someone's missing one tooth, we can cement a crown on it right away. So they have very little discomfort post-operatively because there's no real surgery.
But they are sedated. I mean, for the highly anxious patient that sees you, because I guess if you're wearing a denture, you went through a lot before you became a false teeth person.
We do offer sedation, but most of the time they don't need it.
Really?
A patient who's really, really nervous, will do IV sedation for them. And we're very fortunate to have Dr. Rose Birkin, who's a world-renowned anesthesiologist, medical doctor, who works with us in our facility with both my brother, who's a plastic surgeon, and myself, doing the IV sedation. So if you want IV sedation, you can't find a safer place to do it. We're a fully accredited outpatient ambulatory surgery center with an MD anesthesiologist providing the sedation. But 95% of the patients don't need sedation. It's relatively painless. Some patients may have a little discomfort after surgery, but the procedure itself is really, really simple for them. And most patients do not need the IV sedation. But if somebody's really, really anxious, for sure, we can give them a Valium beforehand to sedate them and calm them. We can give them some oral sedatives, or we can do the IV sedation if they really want it.
Now, we should mention this. I guess how it's normally done with traditional implants is you go to one doctor that does the surgery, and another doctor puts the teeth on top, and maybe somewhere else does the imaging. You do it all right there. Aside from, I guess, convenience, what's the other advantage that you do everything right there under one roof?
Well, we have more control over the outcome, and that's very important, because when a dentist refers a patient to a specialist to have the surgery done, the surgeon doesn't know exactly where that dentist wants the implants placed, so that the outcome, the prosthetic result, is beautiful. And oftentimes the implants may be angled in a wrong direction, and it makes it more challenging for the restorative dentist to get the cosmetic result that the patient's looking for. By controlling it all in-house, both having myself do the surgery as well as the prosthetics, and having the lab there as well, we have dozens of certified lab technicians who work hand in hand with me and with the patient to give them the aesthetic result they want, the beautiful smile that they want and that they deserve to have complete.
Do they end up smiling more?
Oh,
like when it's all
absolutely.
done, like when you see them on follow-ups?
Absolutely.
Because you said they're like different people.
It changes their personality. Now,
Really?
that one girl that I told you about who worked as a waitress, I know her boss, okay? And I happened to go in there for breakfast a couple of weeks after I finished her teeth, and he came over to me. He said, "Oh my God, you changed her complete outlook on life." It wasn't just her smile. She comes in and she's a different person. And he was like going on and on about how happy she is now. Because, you know, when someone smiles, they're happier.
Yeah.
It's a proven fact. People who smile are generally happier people.
Yeah.
And they're perceived to be happier people, wouldn't you say?
Yeah. Yeah.
You know, and so if somebody is in a grumpy mood, they're probably not going to smile very much. And so just changing that look makes people happy.
Now, on your consults, and you say a lot of people recognize you from television appearances, on the news, et cetera.
Yeah.
Do they ever come in, they give you their hard luck story, and in your mind you're going, these people don't even know how good this is going to be?
Yeah.
Really?
Yeah, and you would be surprised about how many patients come in, they have their hand over their mouth, they don't even want to open their mouth, and they say, "I've got the worst mouth you've ever seen, doctor." And I get that probably 3 or 4 times a week. And I say, I promise you it's not the worst. Without even looking at you, I promise you you're not the worst, because I've always seen something worse, you know. And I never judge a book by its cover, because a patient could come in and have the worst mouth of teeth, decay, infection, missing teeth all over the place, but it's not because they can't afford to have the work done or they've neglected themselves. It's because they're scared. So many patients are scared to go to the dentist.
Yeah, nobody likes going to the dentist.
And they may have had a bad experience when they were a child or whatever, and so they've just lived with this constant problem. But the sad thing is that when someone has infection in their mouth, it goes throughout their whole body. It's not just stays, it doesn't just stay in the mouth. It gets in the bloodstream. And it can affect your heart, your lungs, your liver, your kidneys, and even joints. The joints of the body are affected. I had a physician. It's a true story. About 2 years ago, I had a physician, a well-known physician in Buffalo, who was in his 80s, and he walked in with a cane because he had a bad knee. And I did an exam on him. He had a lot of infection in his mouth. And I told him, you need to get that dental work, you know, the infection out of your mouth. And he knew that, but he had been putting it off, because, you know, doctors are the worst patients.
Are they?
Doctors put things off forever because they know too much. But truthfully, the procedure we did, we took out his teeth, we got rid of the infection, we put implants, the mini implants in, we restored his mouth. In about a month, we had all the infection cleared up and all his new teeth in. He came back about 3 weeks later without a cane. And I said, Doc, what happened to your cane? He said, I don't need it anymore. I think the infection was getting in my joint. And I truly believe that.
Interesting. Because it is a bacterial infection, is that right?
Absolutely. His knee pain was gone. He could walk like he was 50 again. It was unbelievable.
So there may be something.
And that's, I believe that to be true.
Now we should mention too that the specialists, the periodontists, the oral surgeons, they are starting to use mini implants. But I've had qualified dentists on my show, on this stage, and they'll say, problem with mini implants, they're too small. They're not there yet. They're not as good as the regular implants.
Well,
what is your response
I don't
to that?
buy into that, Randy. You know, I did conventional implants. My father and I did them for years. I started doing conventional implants in 1989 when I graduated from University of Pacific School of Dentistry in San Francisco, which was, by the way, one of the North American training centers for the Brandemark conventional implants, and I was trained on those. Okay. And so I started doing those in 1989, and I did them all through the 90s. And they were great procedures, and they still are great procedures, but you gotta have enough bone. And if you don't have enough bone, you've got to do a sinus lift, you've got to do bone grafting, you've got to do ridge surgery. And it's invasive, it's involved, and patients don't want to go through all that. Now, the great thing about mini implants is it has a proven track record. When I spoke years ago to you, several years ago, we had a track record, but now we have an even longer track record. We've got 12-year study of 5,600 patients who had mini implants placed. And
How long did you follow them?
They're 12 years,
okay.
12-year study, 5,600 implants, and we have, with crown and bridge, with the procedures we're talking about, with permanent teeth, getting rid of dentures, 96% success rate. That's comparable to any conventional implant out there. And
so they work. So that's behind you.
They work. They work extremely well. And the oral surgeons, the periodontists who were questioning these before, they're starting to understand that they really do work.
And they're coming around.
And they're coming around. And now there's not just me, but there's dozens of articles from all over the world with published research by peer-reviewed, journals in medicine and dentistry that show success rates about the same as the ones that I had.
Now we should mention, because we're short on time, about a minute left, but insurance, even the best insurance, doesn't cover the whole thing. Medicare, Medicaid doesn't cover it at all.
Yeah, but Randy, we'll help them finance it. We can give them 2 years no interest financing, or we can even give them up to 6 years if they need it to pay for this work. So many patients will come in, and even though they don't have insurance, or even though their insurance won't cover much of it, we can help them. We'll get you to where you want to be. You just have to give us the opportunity.
So no more dentures. You're going to wipe them out? You think you should at least wipe them out in Buffalo?
I don't know. I'm going to try. We're going to try to throw away all the dentures. But, we'll see.
Okay, good. Permanent teeth that don't come out. Now, what about this? I'm going to ask you. Somebody even asked me to ask you this.
Yes.
Another dentist. They said, ask Dr. Todd Shatkin if he would put a mini implant on one of his own family members. Have you ever done that?
I do it a lot, actually. My own wife has 3. My mother and father, both of them are passed away now, but they both had mini implants in their mouth. I did my aunt, who's actually just turned 90 years old. I did hers about 2 months ago. So yeah, we do them all the time in our family. I would never recommend something for a patient of mine that I wouldn't have done in my own mouth, or I wouldn't recommend for my own family members.
Now, you're at the top of the game. Everybody knows you are the leader in mini implant dentistry. Does it cost more to go to a guy like you?
No, our fees are comparable to anyone in Western New York. I've always been proud of the fact that I charge a reasonable fee for the services we offer.
Okay, we're gonna take a quick break. You're watching the Wellness Hour. We'll be right back.
My teeth were loose, they were cracked. I couldn't chew on the right side. I think that was the moment that I realized I needed to really do something, is when I could only chew on the left side. I walked in, and 2.5 hours later, I walked out looking like this. They did the procedure all in one day, all within 2.5 hours. Removed my existing teeth that were going to fall out anyway, and put in the mini implants, the rods, and implanted my teeth. So I walked out like this, and it was incredible.
I was immediately won over. I mean, how easy that you can have a tooth placed in your mouth, never have to worry about covering your mouth. You can start smiling again and eat foods that you always eat. So we had scheduled an appointment, I believe within the week. I came in and I was very nervous, thinking, oh my goodness, this is going to be, a very long process. No, on the contrary, it took about 30 minutes long, quick, easy, painless.
I used to talk with my hand in front of my mouth. I used to smile with my mouth closed because I was self-conscious. I almost had tooth envy. I'd look at other people with beautiful teeth and say, oh my goodness, why can't I have that? Well, now I do. And it's an incredible, incredible life-changing event. There was discomfort for probably, normal discomfort that you would feel for a week or two, but the healing process was great.
I walked out that evening and I was able to eat just like I always did. And following that, I flossed my teeth regularly. I brushed them. Nothing any different than another tooth in my mouth.
Now I can eat any food, drink cold. There's no pain. There's nothing. It's changed my life 100%.
You're watching the Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. Dr. Shatkin says no more dentures. Final message. We're out of time completely. Somebody watching this.
Just come in for a free consultation. There's no obligation whatsoever. We'll do the x-rays at no charge. We'll sit down, we'll talk about your situation, and we'll come up with a plan. If you like the plan, let's proceed. I'd love to take care of you.
What's the fastest that could be done? If everything works out right, they're watching the show today, they come in tomorrow.
It can all be done in one visit, Randy.
Is that right?
They can come back within a week or two and have their teeth.
All right, good for you. Well, thanks for coming on the show.
It's a pleasure,
Always a pleasure.
Thank you.
You've been watching the Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.